Hello, welcome to the Still Life Innovators series. I'm Liz Lundry, and today I'm so happy to be joined by the amazing Frances Horning and have a conversation with her. And Fran is an international speaker, coach, and trainer on the topic of biological dentistry. She's the associate director of the International Academy of Biological Dentistry and Medicine, as well as their hygiene committee chair. In addition, she's a lecturer for the International Academy of Oral Medicine and Toxicology on their hygiene committee and a hygiene mentor. Fran is also a lecturer and coach for KT Dental Seminars, an independent presenter at Dental Studies Institute, and the owner of Integrative Perio Solutions and Hygiene Naturally, which focuses on the education of biological dentistry. So amazing wealth of knowledge here. Fran, thank you so much for joining us today.
Oh, Liz, thank you so much for having me. I'm honored to be on your show. It really is a pleasure to be able to share with your listeners. I'm thrilled. Thank you.
You're very welcome. And this is such an important topic, being, part of Stella Life, which uses a natural approach to eliminate chemicals from our patients' bodies and, doing things naturally. This is just so in line with who we are. So can you please share with us, what is biological dentistry?
Absolutely. Thank you for asking. There seems to be a little bit of a misunderstanding about what biological dentistry is, or some people actually equate it with holistic dentistry, biological dentistry is kind of the same thing. They're extremely similar, but not quite the same thing. But there's a misconception that what we do is a bunch of witchcraft, and that we're, a bunch of witch doctors, and we don't shave our legs and we smell like patchouli and we burn incense, and that's your thing. That's great. But in actuality, a lot of what we do is all evidence-based. It has evidence-based science behind it. And the practice of biological dentistry is basically, it's not a specialty in and of itself. It is a thought process or a philosophy of practicing. All of us are conventionally trained. I'm a hygienist. I'm conventionally trained. I went to school, have my licensure through the state. All the doctors, assistants, we're all conventionally trained, but we've made a conscious decision that we wanted to be able to practice in such a way that is going to be more mindful of the body. So biological dentistry, bio meaning body, it is taking into account not just the oral systemic link, which has been very popular the past 10, 15 years, but not just, how the mouth can affect the body, but how the body can affect the mouth. And then anything we do to the body or to the mouth can affect the rest of the body, i.e., are the materials that we're using for our patients, are they compatible for the patient? Like, for example, my son is fatally anaphylactic allergic to peanuts. I can grab a whole jar of peanut butter and eat the whole jar with a spoon. I can eat it. Obviously, he can't. Why is he having a reaction and I don't? Same thing with dental materials. We don't think about the fact that dental materials can actually affect the patient systemically, creating a lot of inflammatory responses. Things like there's hidden infections in the jar. So we're looking for things that are beyond, like outside the box. We're looking for root causes of disease in the mouth and the body. A lot of times we have practitioners like naturopathic doctors, functional medicine MDs, even regular MDs. A lot of natural practitioners or functional practitioners, we work synergistically with them to get our patients healthy, because they can't get their patients well if they have a dental infection or if they have materials in their mouth that is stopping them from chelating or removing the toxins from their body. So it's a expanding way of how you practice. So we're doing dentistry, we're using anesthetics, we're using drills, we're using scalers, we use everything that a conventional practice uses, but we do it in such a way that we're very mindful of how we're practicing, that it doesn't affect the body negatively. And we want to make sure that the patient has a positive outcome long-term from any of the treatment. And we also take in consideration their emotional status, mental status, physical status. So it's all encompassing. It's very fulfilling when you see a patient coming in very, very nervous and upset and not feeling well. And then once they're finished with treatment, when we're working with their practitioner, how much better the patient is, and they're much healthier. Not to say that the dentistry in and of itself created that, but working with their practitioners, it just makes a huge difference. And
Absolutely, yeah, and it's so gratifying, and it's almost like a miracle sometimes when you get those root causes, which of course first you have to find what they are, which is what functional medicine does, because traditional allopathic medicine in the US doesn't cover that either. But until we know what that is, we're really just treating symptoms. We're putting a Band-Aid on something. We're not really treating the whole body, and we're having such an impact on the body, but we just aren't aware of that. And as a hygienist of over 40 years, I have seen so many instances where people are having strange reactions to different materials and, having other issues with their everyday life. So, on that topic, what are some of the impacts that you've seen from traditional medicine, as compared to using more biologically kind materials and processes?
Well, going on that whole thing about, having an allergy or a reaction to materials, there are times where a patient will come in, they've seen their doctor because they were having symptoms and they couldn't figure out what was going on. They wound up going to a functional medicine doctor, and the patient winds up to be mercury toxic. And we can get that from eating a lot of fish. There's this whole warning, when you're pregnant or children, you have to be careful not to eat a lot of tuna. But we don't seem to realize that actually the amalgam fillings that patients have, they can actually increase the amount of mercury in their system, so they continue to off-gas. If a patient has 6 or more amalgam fillings in their mouth, they have about 150% more blood circulating mercury in their system than someone who does not. You can even have somebody who has no mercury amalgam fillings, but if they're around it, i.e. like a dentist or assistant, if they have that constant exposure, they can have high levels of mercury in their system and have symptoms of mercury toxicity. So a lot of times these patients will come in from their functional medicine doctor, and they're trying to remove those toxins, because you can have heavy metal toxicity, lead, cadmium, mercury. So it's not just mercury. So any of these heavy metals, they're trying to get it out. And how do they do that? They use something like an EDTA. They do IV chelations where they're trying to pull the toxins because the body wants to hang on to it. They're called hoarders or non-chelators. So you have to pull it out of the system safely and gently. But if a patient still has these amalgam fillings in their mouth, they're going to still have that off-gassing, or the particular could potentially get into the system. So they're never going to fully be able to chelate. So these functional medicine doctors saying these patients are sick, we need to be able to help get the mercury out. We need your assistance. And how can we remove it safely? Because just drilling out a mercury filling or an amalgam filling without using protection can potentially expose the patient and practitioner to this particulate and the vapor. Now, this particulate can be inhaled through a mask. We have now a lot of us are using the N95s, but if you're just using your regular level 3 mask, that's basically filtering like a micron, the size of a bacterium. But these particulates, amalgam particulates, can be at a submicron level. And that can actually go right through the mask and is inhaled into the lungs, and it stays in there, and it will continue to be in your system. So, I know I'm going down a rabbit hole, but these are the expanded things that we take a look at when we have a patient that's sent to us by a practitioner, and how they're very, very sick. Another patient can have a situation where they're just physically not doing well and they could not find what's going on. So the doctor will send them to a biological dentist, to make sure they rule out any oral infections. We may have them have a thermography, which is it shows pictures where there's heat and cold maps, right? So we'll do that. Then all of a sudden we see there is a red hot heat map in one part of the jaw, and that's draining into the lymph system, but you can't see it on x-rays. You can't see it clinically. And then we do a little more investigation using maybe 3D scanning, whatever, and there might be a focal infection in the jaw. That focal infection can cause things like trigeminal neuralgia, or it can cause physical symptoms. These focal infections might have an abundance of bacteria, funguses, viruses, HPV, parasites. It's loaded. So basically, okay, so what do we do now? We have to clean that infection. It's like an unhealed bone. It's not quite like osteonecrosis. It's similar to, like, for example, if somebody had a third molar extracted when they were a teenager, or any extraction, and years later, they're starting to have now physical symptoms, they can't find the etiology. We find these areas of focal infections. We clean those areas out. You open it, and it's basically a lot of mush. So the bone has healed on the outside, but it's infected on the inside. So now we have to clean out that infection and that bone, clean that out, sterilize it out, and be able to try to get that bone filled in again. We use things like PRF, which is your body's own healing glue, right? Using our own stem cells, our own fibrin. So we'll place that in there to stimulate the body's healing. So the way it should have healed back then, now we can get that to heal. And then miraculously, sometimes these symptoms will subside or go away, because we are now finding, okay, we're just treating symptoms, but what's causing the symptoms? So we were able to, connect the dots one to the next to be able to find, okay, if this may be causing it, let's address this. We've had patients who've had infections cleaned out. They're like, oh my gosh, it's night and day. It's like somebody flipped a switch. Yeah, incredible. And so these are just some of the things. Patients who, so I'm just going to refer to hygiene. A lot of our patients who, and I'm sure you've experienced this yourself, Liz, when you have a patient who has periodontal disease, right? And then you're trying to impress them to them how important it is to get it treated. Somebody who has a history of cardiovascular disease or diabetes or Alzheimer's, and like they need this perio treated, and they're like, no, I'm good. I don't have any pain. I'm fine. I just don't need it. And you're like, oh my gosh, let me please do this for you. I'll do it for free. Like you almost want to do it for free for them because they need it so bad. You want to help them. So how do you impress upon your patient? How are they going to be able to accept treatment? Now, a picture's worth 1,000 words. So we like to use not just salivary testing, which is fantastic. We also like to use phase contrast microscopy, where I will take a subgingival sample, place it on a slide, and then be able to show my patients the active pathogens in their gum pockets in their clavicular space. And what happens is when they see these like little worms, which are the spirochetes, or these parasites, which are the Entamoeba gingivalis, or any of these gliding rods, they're running around on their big screen, they're like, oh my gosh, I don't care what I have to do whatever you need to get that out of my mouth. Yeah. This way they can actually understand their disease better, and it makes a big difference.
So. It looks really scary to them. It's funny you mentioned that, because I was just doing a training as a consultant in a practice in Trenton, Michigan, and they are using a microscope and showing the patient the pathogens. And when the patients see all those snakes and other things squirming around, on that slide, they can't wait. Yeah. They want it out immediately, and they don't have any objections. So that is so huge and so powerful. And not everybody's got a phase contrast microscope, but you can also, there are YouTube videos that you can show the patient so they can see what's actually going on in their mouth, especially if you have the salivary diagnostics there. We know you have this bacteria, this bacteria, this bacteria there, and this is what it looks like. So it's such a huge impact. So that's one way that we can start transitioning toward this more biological approach. But how can a practice that's doing more traditional dentistry kind of go down through that transition in a way that makes sense? And what resources are there for these doctors who want to do this?
Exactly. And then in the fact that you were just saying about using the phase contrast microscope, I found that to be one of the easiest ways to transition. A lot of the offices that I go to help them learn how to use, I train them how to use the microscope, and what verbiage to say to patients. It makes that big difference. So that's like almost going in through the back door. So that's an easy way to start. You want to focus more on wellness dentistry, because sometimes, revamping a whole office, turning on a dime completely biologic right away is very hard for the office and for the patients. A lot of the patients may not understand. So doing something as simple as like, okay, if you're not doing salivary testing, start doing some salivary testing and telling them why. Maybe start using a phase contrast microscope. Maybe start adding, more natural things to the practice, like, homeopathy, like a Stellar Life, or adding more supplements, more nutritionally based things. So start slowly with your nutrition recommendation, adding things to the office that is focusing on overall wellness. Because guess what? The mouth's attached to the body. It's not a separate entity, and we have to start paying attention to that. So there's a lot of resources that we can go to be able to find out, well, where do I start? How do I get more information? Well, of course, I'm going to say the International Academy of Biological Dentistry and Medicine. We are so open to helping people learn about what biological dentistry is. We would love to be able to help you. You can go to IABDM.org. You can even email me at associate.director@IABDM.org. I'll be happy to answer any of your questions or get you started somewhere. Other great resources are the HIAOMT.org or holisticdental.org. These are other organizations that kind of set the standard for the practice of holistic and biological dentistry.
That is great. And it's so amazing because it's not just going to help our patients clinically, but it's going to help our business growth, because all over the country, people are looking for this. People don't want to be using chemicals. They don't want to be getting opioids. And so to have that as part of your branding is really going to help you stand apart from the competition in your community. And what you're offering your patients is so valuable and really improving people's lives, and that's really Absolutely. What it all comes down to. And then we improve our own because of the joy of being able to really change someone's life on this fundamental level. So Fran, I really want to thank you for taking the time today and sharing what you've learned. And I want to welcome everybody to look into this. And as always, we want to thank you for joining the Still Life Innovator Series today, and come back to see us next time, where we're going to get more inspiration from another amazing innovator like Fran Horning. Thank you again, Fran. Thank you.
My pleasure. Thank you, Liz.
All right. Take care, everybody. Goodbye.